Welcome to the strategies that you can implement into your lives to help treat any osteoarthritis symptoms you may be dealing with. So the Burrs Clinic teaches people on other methods to reduce osteoarthritis and associated symptoms. Here's what we recommend. The first thing you need to do is eliminate gluten from your diet. Gluten is found in wheat products such as flour and bread. Eliminating gluten from your diet helps to decrease the occurrence of leaky gut syndrome, which can contribute to the inflammation in your joints. So that's the first thing. The second thing you need to start doing in order to deal with osteoarthritis is to stop consuming polyunsaturated fats from industrial sources. These are vegetable oils such as soybean, canola, corn, safflower, sunflower, grapeseed, and cottonseed oils. They are mainly found in processed foods, and these oils are highly unstable fats that can oxidize easily, which can cause free radical damage in your body, leading to increased inflammation in your joints. You can recognize these oils by reading product labels, food labels, before consuming them. The third thing you can do is completely eliminate hydrogenated oils, which are found mainly in processed food. These oils are toxic for your body. They're unnatural fats. They also are in the class of trans fats, which is in the news for being banned in foods now. These fats can increase inflammation in your body and cause deleterious effects as well. So instead of consuming both polyunsaturated fats or hydrogenated fats, trans fats, you really want to stick with natural fats such as butter, extra virgin olive oil, avocado oil, and coconut oil. Butter and coconut oils are the best fats to cook with. The fourth thing you need to be doing is reduce added sugar consumption. Excessive sugar intake has been shown to increase inflammation in your body, worsening your symptoms of osteoarthritis. Also, in addition to that, strictly eliminate artificial sweeteners from your diet, such as NutraSweet or aspartame. If you need to sweeten something, you can do it in a light way, such as adding a little bit of natural cane sugar or honey or stevia to whatever you're consuming, but don't overdo it. The next thing you should be doing is getting a lot of antioxidants in your diet. Antioxidants help to reduce free radical damage, which therefore reduces inflammation and pain associated with osteoarthritis. The best place to get these antioxidants naturally is in herbs and spices. Also, you should be consuming a lot of colorful fruits and vegetables such as blueberries, yellow bell peppers, green leafy vegetables, etc. The color in the food represents the antioxidant. The next thing to start doing as well is to start a therapeutic movement practice, starting with 3 times a week and perhaps eventually working up to 5 times a week, depending on your needs. You can use this therapeutic movement practice to not only address the problematic joint you're dealing with, but your entire body as well. The Burrs Clinic believes fully that your body is a machine which requires taking care of. Start very slowly with your movement practice or exercise program and work into a more aggressive program, especially at the troublesome joint, trying not to push past 5 out of 10 on the pain scale, slowly increasing the range of motion and reps to build up the soft tissue structures. Remember that experiencing pain doesn't necessarily mean increasing the damage in the problemsome joint. If your osteoarthritis symptoms are very severe, consider getting into a lightly heated therapeutic pool to perform some of the movements initially until you can tolerate them on land. Or you can try to perform light range of motion exercises in a hot shower before trying them in another environment. The program you should perform should be something that you should not dread doing, meaning too difficult or too painful, and it should make you feel better afterwards, which means you need to adjust the intensity of the program, less intensity if needed, if that's the case. Please refer to the Burrs Clinic Joint Solution Series for specific exercises you can do for the affected joint you're dealing with. And the link to the series is attached to this program. The next thing you can do is consider working with a manual therapist that can perform therapeutic soft tissue work on the affected area, the affected joint. It can be with a physical therapist, a massage therapist, chiropractor, or an osteopath physician, or any other professional that works with their hands in a therapeutic way. These interventions can go a long way to improve the pliability and inflammatory status of the soft tissue surrounding the arthritic joint. Just make sure that when you leave these sessions, you should feel better and not worse. Sometimes manual therapists might be too aggressive initially, which can trigger increased inflammation and pain in that area. Also, if you are obese, it's best if you start devising a plan to start losing weight. Less weight means less physical stress on the osteoarthritic joint, less inflammation, and thereby less pain. Simple as that. However, this concept of losing weight is beyond the scope of this osteoarthritic program, but I will refer you to the Burrs Clinic Health for Life series, which a link is provided for. This is a great starting point to begin your weight loss journey. Lastly, another way to deal with osteoarthritic joints and to help mitigate the symptoms is to start increasing the collagen in your diet, consuming collagen on a regular basis. You may obtain collagen from eating meat off the bone, such as a T-bone steak, regular consumption of bone broth, which you can find recipes online to start, preferably homemade, or using a collagen supplement. Collagen contains 3 types of amino acids that will help maintain proper joint health and integrity. The Primal Blueprint, found at www.primalblueprint.com, makes a really good high-quality collagen supplement that you can start using on a regular basis to help with your symptoms. Okay, so there's a list of things you can do. Start incorporating into your life to help you with your arthritic symptoms. But once you start to implement these strategies into your life, you may not see immediate results, and that's okay. Give yourself a good 3 months to notice the benefit of these interventions. If you're taking medications prescribed to you from your physician for your osteoarthritis, please consult with them about continuing their use, and do not stop taking your medication unless you are directed to do so by your doctor. Okay, so that concludes today's lesson on the strategies you can do in your life to start to treat your osteoarthritic symptoms. And I want to thank you for joining us, and we will see you next time.